Medicare A is going to cover your hospitalizations, some skilled nursing. Your Part B is where you pay the premium. So back in the day, before the Affordable Care Act, it was a set premium. It was the same for everybody. Now that premium is based on your income. So you may pay more than the average person if your income is very high. Part B is what covers your doctor's co-payments, your durable medical equipment, and preventative care. Part C is when you're opting out of traditional Medicare and you're going with a private care provider. So if you have a Humana card in lieu of Medicare, you have a Part C plan. And during open enrollment, those are advertised extensively. They're in the newspaper and they're on TV. And they advertise those a lot to say, you'll get a free gym membership and we'll cover your Part B premium. I'm not a big fan of Part C plans for the pure reason that they're very good if you're healthy, but they're not very good when you get sick. And the big distinction is when we talk about skilled care. So under traditional A and B, if you are hospitalized for 3 nights and you've been admitted, so why do I make admitted is a big deal? Under the Affordable Care Act, the hospitals are getting financially dinged if they have an early readmission. So if an elder came to the hospital and was admitted and discharged and they come back within 60 days, the hospital is going to have to pay money because they came back too soon. So what they're doing a lot of times is they're having people be under observation. You're not going to know that, and you're going to think the person's admitted because they're going to be in a room and they're going to be getting services. So when you're advocating for your loved one, you need to say, I need confirmation that my loved one's been admitted, because that's what triggers your 100 days of skilled nursing. They're required by law now to notify you in writing, I believe, within 24 hours of the admission, and that was part of some work the Elder Law Committee did because they had no requirement to notify you until you were being discharged, which doesn't help you if you then are trying to be placed in a nursing home. So after a 3-night hospital admission, you then tap into, under Part A, up to 100 days of skilled nursing. Your first 20 days is paid 100%, and from day 21 to 100, you're going to have a co-payment. If you have a supplemental Medicare policy that covers the co-payment, you'll be made whole. And the co-payment can be around $225 a day. Up to 100 days, well, what does that mean? Under the rules from the center CMS, you have to prove to the nursing home that you're either stabilized in your rehab or you're improving. If you're declining, your Medicare will stop. If you refuse Medicare rehab 3 times, your Medicare will stop. Why is that important? With dementia, the physical therapist comes into my room, I suffer from dementia, and I say, I don't want to go. And the physical therapist said, well, it's your time, you need to go. And I say, no, get out of my room. The physical therapist leaves. If I do that 3 times, I'm going to be cut off of my Medicare. So sometimes what we have to do is we have to hire a caregiver or have a family member there or have a geriatric care manager involved to help get that person to rehab to keep the 100 days. After the 100 days, I still might not be able to walk. Let's say I broke my hip, which is the most common reason I go to the hospital. It's the most common admission to the nursing home. Say I break my hip, but I also have severe dementia. So I did some of my therapy, but I didn't really, it was hard for me with dementia to really participate in my therapy, and I still can't walk. At that time, if it's cut off or I lose my or I've maxed out my 100 days, you're going to get a call, and unfortunately it's usually on a Friday, and they're going to say, your mom's Medicare days are done and we need you to come pick her up. Or you can start writing us a check for $9,500 a month. Well, that would be a shock because mom can't walk, mom has dementia, I work full time, I have kids. What are we going to do? And the fear of paying the $9,500 is probably going to force me into my car and pick up mom because I don't know what else to do and we don't have the $9,500. That's a very common scenario. So let me help you with some strategies. Under federal law, the nursing home cannot discharge mom if she cannot safely take care of herself. So their duty is to find a safe alternative placement. So if you get the call and you can't take care of mom, if you can take care of mom, you should go get her. But if not, you say, I cannot safely take care of her. I need you to find a safe alternative placement. Because if you go and pick up mom, now you're responsible. And that's what they want. They want you to come get her so that they don't have the onus on them to find the placement. Under federal law, they cannot send mom home without care. They cannot just discharge her. They would have to find another nursing home for her to be in or some other safe placement. That's what the law says. The reality, they will oftentimes send her to the hospital for altered mental state and then say they don't have a bed, but then it's the hospital's problem to find placement. Or they will send her to the hospital for dehydration or UTI and then not take her back. So the days of them putting mom in a taxi home, I haven't seen that in a long time, thank God. But I had seen occasions where they sent an elder home with no money, an ID, and she was very confused. So if you can pay privately, of course you would pay the time for her to stay there.